Okay, so we're here with Monique today. She has had a long-standing knee issue. Thought at some point it might need replacing, but we took some x-rays and there's still a joint there. But she's very active, loves to walk many miles a week, and it keeps her up at night, or it has been, and it's just hard to squat and do anything with. We brought her in last week. She had her first Shockwave session. I'll let her tell you about how it felt after that, how it's been. It's been a week ago today, how it's been, how she's felt. And then we're going to do a session, and then we're going to talk a little bit more about how she feels after the session. Okay. All right, Monique, go ahead.
So when I first came in, I've been dealing with knee pain for years, and I know a knee replacement is probably not in the cards, but it's kept me up nightly. It doesn't stop me from doing my exercising because I just push through it. But with the treatment that I had last week, I literally got off this table and I felt nothing. So that was pretty amazing to me. Throughout the week, it has probably been that way most of the time, and I will say that I've walked probably 5 to 7 miles at least 4 days out of that week, and it never stopped me at all. So that's been terrific for me. Only today did I really start feeling a little bit of tweaking coming back, but still nothing as to what it was before the first treatment.
Did you mention in that sentence there that about it waking you up at night to sleep and it hasn't been? Did you mention that?
Don't know, but that's been the case. So I will lay awake at night sometimes because of the pain that it causes. Because every time I move around, I can feel it. But for the last week, that has not happened once.
And it didn't come back last night, right?
No,
today.
it did not.
Great.
It did not.
Okay, so we're gonna go ahead and do a second treatment today, and we're also gonna check a little bit into her foot. And then we're going to ask Monique how it feels after the treatment. Can you stand up right there and just do a little squat for me? Let's see where your range of motion is. It's all right. Did I give you much space?
Right about there for now.
Wow, that's crazy more than it was last week.
It was more than last week.
Wow.
Yeah. So it's about the same as it was after the treatment.
Okay. Jeez.
But my knee's has been bad enough to where I try to stay away from squats. And
Yeah,
lunges.
for sure. How was the stairs coming up today?
It bothered me, but again, not at the same level.
Okay.
The stairs are probably my worst downfall.
Now you were actually having quite a bit of, took a little bit of energy. I'm gonna start you out at some a little higher. First, I'm gonna go all through it. I'm gonna do some mapping, find out where your hot spots are, okay? And then we're gonna go back and spend some time on those. I remember it's, you know, in here and then down in here. But we're gonna see if those change. They don't at all for you, okay? And if you remember, I want your discomfort to be somewhere between a 5 and 8 out of 10. I don't really want it higher than an 8, but I want it above a 5. And if it's higher than those, we'll turn it down. Okay?
Yep.
Let me see if something changed there. And what was that? Just kind of when I zapped you, you felt it?
It woke me up.
So give me numbers when you find hot spots. I know where we're at, okay?
Yeah, right there.
What number is that?
That's probably a 7.
Okay.
A little more.
Okay.
A 9.
9. Okay. We're gonna back you down and see where we're at. And then, you know, as you know, remember last week we came back and it wasn't as
And
much.
went back up.
Yeah.
Yep.
Where we at?
A 4.
4. Okay. How about that?
Not much. That's a 5 or 6. As you watch me tweak, that's a 8. That's an 8.
Anything in here?
Yeah, that's about a 5. That's an 8. That's a 9.
Okay. Want me to back down? Are you okay?
No, don't want to put that down.
You know, if I pass out, then you can break it
If I
down.
pass out, yeah, exactly. No, I was so encouraged by last week that I want to keep it going. That's a 5.
Try to come up here a little bit. Anything up in here?
Yeah, maybe a 2. That's quite a bit. That's a 8.
Okay, we are 3.
Probably a 4.
Okay, so our hot spots are here, this horseshoe right here, yeah?
Right.
Okay. Give me a number in case you wanna go up.
Okay. That's probably a 5. Same. A little bit less.
Okay, so it's already went down then, feels like.
In here, yes.
Okay.
When you're kind of on the cap,
Uh-huh.
it's a little different.
Okay.
Like right there.
Okay.
That's a 9.
Okay. Let your knee relax if you can, so we get in there.
Yeah.
Still a 9?
It's hard to relax. Yeah, that's a 9 in there.
Okay.
That's a 7.
How about that?
That's a 9. If I kick you, it's a 10.
Gotcha. Okay, so we're at 500 right there, and then we're gonna use the rest to do the foot, okay?
Okay.
Let me clean this up, I'll have you do a couple squats,
What does 500 mean?
500 impulses. We're
Oh.
using we're doing,
Usually.
we're doing 700 a week, for
Oh.
6 weeks, is what the knee is. Okay. I actually think that Chad, last week, if I remember correctly, I think we might have did 1,000 on you, I'm not sure. We'll see, if there's a difference, then we'll figure it out.
Okay.
So go ahead and stand up for me. I'm not gonna get awkward because you'll have one shoe on. But try and squat and move around, see if you notice anything different.
Okay. Yeah, I can squat further.
Oh, geez.
Like by a lot.
Wow.
And I don't feel it right now.
Look at that. You don't feel it at all.
I don't feel it at all.
So you have no pain in your knee right now?
Right this minute, I have nothing.
Wow. That's amazing.
Yeah.
I mean, considering the history of your knee.
Yeah.
'Cause
For
it's been-
years.
How many years?
I can't even tell you. I mean,
15,
it's,
20-ish,
oh,
you
yeah.
gotta guess.
I would say, yeah, probably. And of course, getting worse with age.
Yeah.
But yeah, I mean, I stay away from squatting.
Yeah.
I don't feel it right this minute.
Yeah, 21's a real dog now.
Age-wise?
Okay,
I wouldn't
so-
even want to be.
So you came in, obviously on video we could see you squatted a lot more. I'd say it was probably like another 8 to 10 inches it looked like to
Yeah,
me.
agreed.
And your pain level was what when you came in? I don't know if we asked you.
3?
3, and now it's
4
0.
right now it's 0.
Last week it was 8.
I would say it was probably, I got it right
I
on the
know,
threshold.
yeah, for
So
sure.
let's say it was a 6 to 7.
6 to 7
And I
last
would
week.
say it went down to a 3.
So 50% from last week, and then today so far is 0 after this treatment.
Right.
Next week we'll try and do it again. We'll see where you're at. We'll document it and we'll see how we go.
Right.
Okay.
Yep.
Awesome. All right.
Okay.
We're gonna go ahead and do your foot. We'll stop the video right now.